You probably have some idea that nursing research is important. But let's be honest, when most people hear research, they tend to tune out. It sounds complicated, very academic, and maybe even a bit boring. But what if I told you that nursing research is the backbone of everything you do as a nurse? Every protocol, every patient care guideline, every little adjustment in hospital policies, it all comes from research. Whether you're a nursing student, a new nurse, or an experienced nurse wanting to level up, understanding nursing research isn't optional, it's essential. Spare me a few minutes and I'll break this down in a way that actually makes sense. No jargon, no fluff, just what you need to know to use research to improve your practice and ultimately patient care. Nursing research is the process of systematically investigating questions related to nursing practice. It's not just for scientists in labs, it's for you. It's about ensuring that what you're doing at the bedside is actually working. There are three main types of nursing research. 1. Quantitative research focuses on numbers, statistics, and measurable data. How effective is a new medication? What's the recovery rate for patients using one technique versus another? 2. Qualitative research centers around experiences, emotions, and behaviors. How do patients feel about their care? How do nurses cope with stress? 3. Mixed methods research, a combination of both statistics and feelings, because sometimes one approach isn't enough. Without research, we'd be guessing. And in healthcare, guessing can cost lives. So, whether it's testing new treatments, studying patient behaviors, or improving nursing techniques, research plays a crucial role in patient care. Let's break it down further. Here are some important aspects of research: primary versus secondary research. Primary research, first-hand study where data is collected directly from participants. For example, Dr. C published a study with 200 nurses showing that mindfulness-based practices decrease stress levels. Secondary research, reviewing and analyzing multiple studies to draw bigger conclusions. For instance, Dr. C conducted a systematic review comparing 15 different studies on mindfulness practices and stress reduction. Research question. Every study starts with a question. For example, does mindfulness-based practice reduce nurse burnout? Hypotheses are then created based on the research question, and the study tests that question with real data from nurses. Research design, the game plan for how the study is conducted. It can be experimental, testing an intervention like a new treatment, or observational, watching what naturally happens. Data collection and analysis. Studies use surveys, interviews, or previous records to gather information. Then, data is analyzed, statistics in quantitative research and themes in qualitative research. Ethical considerations. Research isn't a free-for-all. There are strict ethical guidelines to protect participants, ensure informed consent, and maintain research integrity. Evidence-based practice, EBP. This is where research meets reality. It's about applying what studies have proven to improve patient care. For example, Dr. C can use her research findings to help hospitalized patients feel less stressed. Knowing this stuff isn't just about passing an exam, it's about being a better nurse. So, if you are finding this content helpful, like this video and drop a comment below. How do you see yourself using research in your nursing career? You might think, this is cool and all, but do I really need to know this? Yes, you do. Here's why. Research improves patient outcomes. Research informs the best ways to prevent infections, manage pain, and provide holistic care. Research enhances professional development. Staying informed keeps you ahead in your field. You're not just following orders. You understand the why behind them. Research supports evidence-based practice. No more relying on outdated methods. The best, safest, and most effective care comes from research-backed decisions. Research influences healthcare policy. Hospital rules aren't random. They're based on research. Understanding research means you can advocate for better policies. All right, so how do you take all this information and actually use nursing research in your career? Here's what you can do. 1. Stay updated, read nursing journals, attend conferences, and keep up with new studies. Following professional nursing organizations can keep you in the loop. 2. Apply evidence-based practice. Don't just do things because that's how we've always done them. Use research findings to make informed clinical decisions. 3. Get involved in research. You don't have to be a scientist to contribute. Participate in studies, help collect data, or work with researchers. Process improvement projects at your workplace are a great place to start. 4. Advocate for best practices. If you see a better way to do something, use research to back up your ideas and push for change. As a nurse, your role isn't just to follow instructions, it's to think critically and ensure that patients receive the best care possible. Research gives you the power to do that. Nursing research is about systematically improving patient care through quantitative, qualitative, and mixed methods research. It's essential for improving healthcare, advancing your career, and shaping policies. You can use research in your practice by staying informed, applying evidence-based practice, participating in studies, and advocating for change. You don't need to be a researcher, but you do need to understand research if you want to be a top-tier nurse. So, what's next? Are you going to take action and start using research in your practice? Or are you just going to let it be another thing you sort of understand? Nursing research isn't just about academia, it's about real-world impact. If you found this video helpful, subscribe to the channel for more nursing education content.